Buongiorno and hello from Italy. My name is Schneider. I'm an orthodontist in private practice in Bolzano, a visiting professor at the University of Ferrara in Italy, and the corresponding author of the present paper.
Since decades, the discussion whether orthodontic space closure or implant substitution for patients with congenitally missing upper lateral incisors leads to more aesthetic, functional and stable results is ongoing. Our group has noticed that the advocates of space closure base their opinion on relatively outdated studies, which have mostly not examined implant bone crowns for substitution of congenitally missing upper lateral incisors, but only removable or fixed bridgework. To our knowledge, the only thorough evaluation of the aesthetic outcome of space closure versus space opening and subsequent replacement of the missing teeth by either bridgework or implants, where frontal dental photographs of treated agenesis patients were judged by dental professionals and laypersons, was performed in 2005 by Armbruster and co-workers. Photographs of a dentition with no missing teeth served as controls. The authors reported an overall consensus in all respondent groups that space closure or a natural dentition has more aesthetic appeal than a dentition with Maryland bridges or implant bone crowns. But when we took a closer look at the clinical examples that were presented, we noticed a certain bias in patient selection, because all bridgework and implant cases displayed disturbing aesthetic features that were not related to the prosthodontic work, such as malaligned central incisors due to poor orthodontic finishing, inflamed peri-implant tissue, or a black triangle between the central incisors. In the last years, tremendous improvements in implantology, periodontology and prosthodontic therapy have been made, and mandatory prerequisites for achieving predictable aesthetic results of implants in the anterior maxilla have been established. To date, patients with congenitally missing upper laterals can be treated very successfully with implant bone crowns, as you can see in this exemplary patient, but close collaboration between all involved dental specialists is of utmost importance. Our group was interested to know whether the implementation of these new developments in implantology and prosthodontics would not lead to better scores of the aesthetic outcome of implant bone crowns compared to the 2005 Armbruster study. And therefore we decided to perform a similar evaluation, with the only exception that Maryland bridges for substitution purposes were not evaluated this time. 3 intraoral dental post-treatment photographs of patients with uni- or bilateral agenesis of the maxillary lateral incisors were presented to a panel of dental professionals and laypersons. Photographs of treated patients with no missing teeth served as control group. The panel rated the aesthetic appeal of the anterior dentition by completing an anonymous questionnaire with 7 bipolar adjective pairs. In contrast to 2005, we assessed that dentists have equal preference for canine substitution and implants, and that orthodontists even slightly prefer implants to canine substitution nowadays. However, laypersons still prefer space closure. And all these results were statistically clinically significant. The most substantial aesthetic improvement between 2005 and 2015 were assessed for implant-supported crowns, and these improvements were perceived by all 3 responding groups. Very interestingly, both studies revealed that laypersons tend to prefer space closure even to a dentition with no missing teeth. This could mean that our professional code of aesthetics and sense of proportion may differ from our patients' perception of attractiveness, or in other words, our patients might prefer larger maxillary lateral incisors for an optimal aesthetic treatment outcome. Our results underline that in order to achieve complete patient satisfaction, we have to make the correct treatment decision mutually, as Dr. Kokic already stated in his editorial in the AJODO in 2011. And lastly, we should not forget that excellent aesthetics are only one aspect of successful treatment for congenitally missing upper lateral incisors, and that achieving solid buccal occlusions for good function and stability must also be considered an important treatment goal, and this should be thoroughly explained to our patients during the treatment planning process.
Therefore, our next study will not only focus on long-term stability of aesthetics, but will also address important functional aspects, such as periodontal health in the long term, in both groups of treated patients. Thank you very much for having watched our video, and we hope that you will now enjoy reading our paper as well.